Welcome back. We've seen so many mass shootings in Colorado, Columbine, the Aurora movie theater, Boulder King Super, so many others. It can be a lot to process, especially when it's targeted toward a community that has already experienced so much loss. This morning, we're joined by Dr. Sheryl Ziegler to help members and allies of the LGBTQ community handle this trauma. Nice to see you. Thanks for coming in. We were talking earlier, unfortunately, hate crimes are just on the rise everywhere.
They are. So when we look at the statistics, if you identify as LGBTQ+, you have about a 1 in 5 chance of having a hate crime against you. And if you're transgendered, about a 1 in 4 chance of having a hate crime against you. So we know really specifically, even within the community, there's some differences. And we know that we've been tracking this for about a decade or so, and that really these hate crimes are on the rise.
Yeah, and it's so sad. So as far as mental health is concerned, this could affect you, of course, if you're there. Obviously, it'll affect you, but even if you're just a member of the community or just an outside observer, it can affect you, right?
Absolutely. I think for the people that are there, the few of them have been interviewed. It's pretty consistent. There's just this sense of numb and shock. And then for the survivors, a lot of them will eventually go into survivor guilt. You know, why did I survive? Why not me? Could I have done something more? That's a really common theme. And then there's the community at large. And some of the community at large will honestly become numb to this in a way that says, oh, it's just another day. And that's one of the things we think really needs to not happen. We need to be compassionate. We need to care, and we need to all feel like there's something we can do. And that's really the key, whether it was somebody who was actually there and witnessed it firsthand, or it's community members. We all can do something, and that's what people have to remember, that we're not powerless and we're not helpless.
Yeah, what are some of the things out there that we can do? I mean, I know there are a lot of resources available that we can visit, but other than that even?
Yeah, I think there's a couple of things. I think if you are an ally, you're a loved one, a family member, someone who was directly there, you're supporting them, and you're also knowing when to say maybe you need some professional help, right? So that's nightmares, fear of going to certain places, and Americans already have that. A third of adult Americans say they don't go to certain places because of fear of a mass shooting.
Wow.
So that's really high. But then there's also the piece of, even if you've got little kids, we know that the perpetrators of these kinds of crimes are oftentimes young, white, adult males. And there's a history, usually a strong history of bullying. So true anti-bullying programs in schools that have data behind them. Sometimes what we're looking at is when we're looking at the younger times, we're talking about safety, we're looking at police officers and things like that. And what we know is that there are also equally a lot of psychological mental health kind of programs that can hopefully help channel this hatred and help them, process and redirect that so they don't become 18 to 22 years old and think about perpetrating a mass shooting.
Yep. Wow. Well, I guess the good news is, as we mentioned, there are a lot of resources out there to help people if they seek that help.
Yes, there are.
Yeah. Okay. Dr. Sheryl Ziegler, always good to see you.
Thanks for having me.